This is a production of WEDU PBS, Tampa, St. Petersburg, Sarasota.
Coming up next, this Tuesday is the big day, the day of the presidential primary election in Florida, and it comes as the number of coronavirus cases in Florida is rising. What is the state of Florida doing to keep citizens safe during the coronavirus outbreak? Is the virus going to impact voters who arrived at the polls on Tuesday? And how well is the state dealing with the problem? Those stories and more next on a special edition of Florida This Week.
Welcome back. Well, the coronavirus outbreak is on the rise here and in many other countries. So what is the state of Florida doing to protect citizens and to ensure that this Tuesday's presidential preference primary election goes as planned? On the special edition of Florida This Week, we're going to present information about staying healthy and exercising your right to vote.
No one is certain how bad the problem will eventually become. But already, the coronavirus has had a big and negative impact on conventions, travel, sporting events, and the cruise industry, all pillars of Florida's tourist economy. Earlier in the week, Governor Ron DeSantis pushed back on the idea that community spread had already occurred in Florida. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, had made that claim about Florida. That disagreement between federal and state officials has led to mixed messaging in response to the virus. Governor DeSantis says we need to increase the number of tests done in Florida, but are those tests available? In Tampa, Mayor Jane Castor appeared with leaders from local hospitals and health officials to inform the public about their ongoing efforts.
We need to ensure that we're providing accurate information and that all of our community is getting their information from an accurate source. And that can be the CDC, that can be the Hillsborough County Health Department, that can be the state emergency management, or here locally at tampagov.net.
Disney World is closing. Sporting events with large crowds have been affected. The upcoming Valspar golf tournament in Palm Harbor has been canceled. This weekend's St. Petersburg Grand Prix will go on as scheduled, but the general public will not be allowed to attend. And St. Petersburg Mayor Rick Kreisman said it was a tough decision. At Florida State Universities, all in-person classes have been suspended. Instructors are preparing for online learning. With Election Day this Tuesday, some older election workers have dropped out due to virus concerns. Pasco and Pinellas counties have reached out to younger workers to fill in. Some polling places and assisted living facilities have also been moved due to concerns over the vulnerability of the residents. The symptoms of COVID-19 coronavirus, according to the Centers for Disease Control, are fever, cough, and shortness of breath. These are likely to appear 2 to 14 days after exposure.
And to update that story, the St. Petersburg Grand Prix has now been canceled. If you have those symptoms that I talked about, fever, cough, and shortness of breath, and you think you've been exposed, you should call your health care provider for medical advice on what you should do next. Late Friday afternoon, President Trump declared a national emergency due to the coronavirus. Here to talk about the coronavirus outbreak and the upcoming election are Caitlin Johnston, is a reporter for the Tampa Bay Times. Yvonne Fry is a businesswoman and a consultant and a Republican. And Cheryl Wilson is the past chair of the Manatee County Democratic Party. Craig Latimer is the supervisor of elections for Hillsborough County. And Dr. Jason Wilson is the Associate Director of the Adult Emergency Department at Tampa General Hospital. Well, I think we can answer any question with you all here, so thank you for coming. Jason, what's the most important thing that the public needs to know about contracting the virus and protecting themselves against getting it?
Sure, Rob. So I think one of the first things that we should know is my kid goes on spring break right now, and you know, he had plans to go to Disney. He's supposed to have a Little League baseball game tonight. These are very frustrating things for him and for many families. I think one thing we need to understand is to be a little patient right now. That little bit of patience right now is going to really pay off for us in the long run. And what I hope we see is that this sort of curve, this sort of growth rate curve of cases flattens out or dissipates over the next couple of days or weeks. I think the other part of this story, though, is things are going to start to maybe look a little worse before they look better. And what I mean by that is we have to be very calm in the sense that we are just now really getting online with where we should be with testing. That's ramping up at most major healthcare systems throughout the state. And so by definition, what we're going to see, if we look for it, we're going to find it. And so if we start to see the number of cases rise, keep in mind that we have a pretty good social distancing policy going on throughout the state in terms of what we're seeing get canceled, but we're still going to see cases maybe rise in that setting.
When you say social distancing, how should people, when they go to the grocery store,
Right.
when they go to the gas station, what should they be doing?
Sure. So first of all, if you personally have fever and a cough, it's really best to stay away from people right now. And so I think that's one of the responsibility things we each have to have on our own. Now, if you are not a person with fever and a cough, here's the sort of things I think get a little bit confusing for people. I just taught an undergraduate class at the University of South Florida today, and I had a group of 21-year-olds or 20-year-olds in front of me, and they all said, look, if I get this, I'm going to be fine. I said, well, didn't you just tell me you're thinking about going to Nebraska to see grandma? Right, so if you get this and you take it home to Nebraska to see grandma, and grandma's in the nursing home, and grandma's whole nursing home gets it, now we have a problem. And so I think we have to think about each individual risk also when we go places. And so the older we are, the probably more likely it is to get sick from this virus. And so decisions have to be made around that. I can probably go somewhere safely, and even if I get the virus, it's not going to be a big deal. But I work at a Tampa General Hospital, and I have a responsibility not to bring it back there. So I'm not saying don't go to the grocery store. I'm not saying don't go out to eat. Just if we do that, think about where you work, what your context is, and then, fortunately, one of the things about this virus is we do know that simple sanitizers do tend to kill the virus. And so wiping down surfaces, I think most of the grocery stores have those wipes that you can use in the shopping cart. It's hard to find the hand gels right now, but, if you have those things, try to use those things. Really no evidence that wearing a mask out in public helps. I've seen that sometimes, and I would say that we're not in a shortage yet for supplies, but we could, if things were to get worse, we could get there. So I would not suggest wearing masks or anything like that when you go in public.
Dr. Fauci said that there is community spread of the virus. Let's say that you're a senior citizen, you're watching this show.
Yeah.
Should you stay home?
So again, I think it's going to depend on you as a senior citizen. We see a lot of 70-year-olds who are very healthy have no medical problems whatsoever. We see other people who are 70 and have quite a bit of medical problems. So the more immunocompromising medical conditions you have, the probably higher your risk is. Immunocompromising means things like being on chemotherapy, being on medications for diseases like lupus, even being on with diabetes and being on insulin. We worry about those things. So I don't think we're at the point yet where we have to say stay home, but if you have other medical problems, you're going through medical treatment for something, probably best not to go into a large group of people. Even if you're being treated for a medical condition, even a religious gathering as a large gathering, maybe skipping that in person this week, those types of things I would probably do right now.
Craig, let me turn to you. Do we have anything to fear for Tuesday's election in terms of contracting the virus? What steps are you taking in Hillsborough County to prevent the spread of the virus?
Yeah, so we've been in close contact with our state officials and the local officials. We're following the CDC guidelines, public health policy, good hygiene, what we keep talking about. Wash your hands, cough and sneeze into your elbow. We have every one of our polling sites on Election Day and the early vote sites right now. They have hand sanitizer and they have wipes that are supposedly for the coronavirus. Mm-hmm. We're talking to our poll workers. If they don't feel good, we don't want them coming in. So we've got some backups. We've reallocated some people. The state just put out some guidance again, and the Secretary of State just says that we're voting Tuesday, and we've got nice, clean places for people to come vote in. If somebody's uncomfortable and doesn't want to come in, the 70-year-olds that the doctor is speaking of, you can fill out an affidavit and have someone pick up a ballot for you. It's a vote-by-mail ballot, and then it has to be back in our office by 7 o'clock on Tuesday.
Do you call the supervisors of elections to sign? How do you sign that affidavit?
You can pull it offline on my website. It's on votehillsborough.org, or call the office. Call any supervisor of elections office and tell them that you want to get an affidavit, and they will make it accessible for you.
Is it too late to pick up a mail-in ballot?
It is not. You can still go to any of my 4 offices and pick up a vote-by-mail ballot, and we'll be open through the weekend. Right on till the election day now.
If you choose to vote by mail, when does that ballot have to be into the local supervisor of elections office?
It has to be in my office by 7 p.m. on election night, which is the 17th.
So not midnight. It's got to be at 7 o'clock.
p.m. And it's not postmarked by the 17th. It has to be in my office, and it's too late to mail it back now. It needs to be dropped off.
All right, so don't put it in the mail. Let's talk about the political aspect of this. With the shutdowns of the golf tournaments, of the places like Disney World, of the theme parks. I mean, Florida's economy is going to take a hit right now. Caitlin, let me start with you. How bad do you think the hit is going to be to Florida's economy with where we're at right now?
Sure, right, and that's what we're in the middle of, and I think that's what's so difficult about this right now for people is that it's all unrolling. You know, within 48 hours, you hear, you know, Disney and Universal closing, and now we hear Busch Gardens is closing Monday. You know, Norwegian Cruise Lines, you know, suspending theirs. And this is what Florida runs on, a lot of it. And even the idea of people don't want to fly anymore and are, you know, making choices not to, so trips are getting canceled. I think a big question is, how long is it going to last? Are people going to rebook those types of trips? Is it going to be a stronger swing in the, you know, later half of the year? You know, are people going to move spring break items to summer break items? But right now, it's just the concern that's generating is because we're really right on the tip of it, and we're seeing how it plays out.
Yvonne, the president on Friday declared a national emergency. So how well is the president responding to this? How well do you think the governor is responding to this?
This is unprecedented, what we're facing right now. And so we're all, to play quarterback, you know, the armchair quarterback is difficult because there's so much that we don't know. And you know, we're following along on the economy piece. You know, America and Florida and our people are strong and resilient and are going to come back and do what they need to do. I've seen communications from so many companies, but one that really hit me today was from Richard Gonsmart. And you think about the breadth of his companies and so on, but the spirit he brought to that.
Of the Columbia Restaurant
the
Group.
Columbia, Eulalie,
Yeah.
Goody Goody, on
Yeah.
and on. And what that means of his commitment to his people and encouraging people responsibly, go out, spend money, don't let the economy completely seize up. We see the stock market's bouncing back. That's good news. But we are in unprecedented times, as I said. To be able to have a crystal ball in this is very difficult.
Well, and you also want to make sure that you're not too scared of uncertainty too. Like when it comes to election day turnout, you know, people are like, are people going to come out and vote? Well, it's also important to remember that we've already had a lot of people vote by mail and early voting. I think it's 1.2 million so far by mail, and 453,000 voted early. I mean, those are pretty strong numbers. So it's yes, there are moments that we're going to be uncertain about, but there's also things that are already going on and continuing to happen.
And there's been a record turnout in Hillsborough.
Yeah, we are still seeing a lot of turnout, that's for sure. We're averaging between 2,000 and 3,000 people early voting a day. It's already spiked up a little bit today, but we're ahead of the 2016 to date right now for the number of ballots that have been cast.
Sure. What about from your position? How do you think President Trump has responded to this? How do you think the governor's responded to this? How would you characterize it?
Leaders lead. I think we're in a position where we have people trying to step up, and I would be less than honest if I didn't say that I think we're stepping up a little bit late to the plate, and we have come into this late. The concern that we hear most in our political office is the contradiction of what we're hearing from the federal level and the state level. Governor DeSantis, I guess just last night, commented that there did not appear to be community transfer in Florida, where we know that in Sarasota County at 10 o'clock last night, the Sarasota Memorial Hospital announced that they had a new diagnosis, which appeared to be nothing but community transmission. So again, with the economic leaders that are stepping up, the people that are getting us able to exercise our right to vote are stepping up. Leaders lead, and I think we're at a juxtaposition where we have a crisis and we have the opportunity now to choose some leaders. And politically, that's what we do.
Jason, there's been a lot of discussion about tests and whether or not it's important that a lot more people be tested. Right now, as we tape this show, under 500 people have been tested here in Florida. As a physician, how important is it that people get testing so that we don't have a massive outbreak of this virus?
It's a great question. I think everybody recognizes at this point, especially after the press conference this afternoon by the president and his staff, that we are behind the curve here on testing. And you look at some of the other countries, South Korea is a great example of one that started early testing and has a pretty good description of what this virus looks like in their country. And what we worry about here is that we can't really describe the epidemiology of the virus very well because we don't know. So you hear conflicting statements from the governor and from the federal government and from the hospital system all at the same day at the same time because we don't really have a good handle on what's going on here right now because we're not looking for it. Now, you know, there's an old adage in medicine, if you don't look for it, don't check the temperature if you don't want to find a fever. And sometimes it's actually a reasonable philosophy in medicine. If it's not going to change anything, why look? But here is something that's very important and different. Here we know this virus is very infectious, right? So if your average flu virus infects 1 1/3 of a person, right? So every 3 people have the flu, you might infect a person. Now the measles or something is very infectious. That might infect 3 or 4 people every time you get that. This is kind of somewhere in between. So maybe every person who has virus infects another 2.5 people. That's a pretty significant infection rate. We're not going to stop the spread unless we know who has it and can increase the social isolation, social distancing for those people.
As of Friday, the Florida Department of Health said that we had under 50 people who have contracted the virus, COVID-19, which is the disease that results from the virus.
Correct.
So would you expect that number to be accurate, an accurate account of how many people are infected right now?
Yeah, actually, you did say something actually really important I do want to hit on. So COVID-19, I think, is right now the name of the clinical syndrome or the disease state you get. SARS-CoV-2 is the name of the virus. And one of the things I think is we have to wrap our heads around is you could have SARS-CoV-2 and essentially be asymptomatic. You could have SARS-CoV-2 and have a bad cold, or you could have SARS-CoV-2 and have acute respiratory distress syndrome, be very sick, and have true, COVID. And so we're trying to, but I can't tell you exactly where those pieces are because we need more data, and testing is kind of how we get there. And so I think as we start to see more testing, we're going to see more cases. So to go back to your question, do I think we really have 50 cases? Well, no, we've tested people who met very strict criteria because we have limited testing. And so we looked for a number of people where we found 50 cases. Now, I think what you're starting to see, I know a couple of commercial labs have gone online. You're seeing some homebrew kind of FDA-approved sort of testing going on within hospital systems. I think you're going to start to continue to see the scale up of testing over these next few days and weeks. And I just go back to that. Don't get too worried if you see those numbers start to really rise because that's what we need to do. The only way we're going to get a handle of this is to let the numbers rise so we can really characterize the virus. The WHO actually issued recommendations that say to do exhaustive testing. Are
we doing that?
2 days ago, we weren't there. I think what we're trying to move to is there. So you saw the commercial labs coming online, sort of in-hospital systems coming on, and now what you're seeing is the leadership question. You're starting to see some coordinated healthcare systems and coordinated at the local level, pretty interesting partnerships and coordination. You're starting to see how do we have a county response to make sure people get tested at the right place at the right time, right? If you are asymptomatic, you probably don't need to go to the emergency department to be tested, but maybe you do need to be tested. Maybe there's a drive-through location we're going to design somewhere for you. Maybe there's a urgent care or a site that you're going to go to. If you're sick and you've had a lung transplant or you have other medical problems and you have a fever and a cough, maybe you do need to come to the emergency department and go through that algorithm.
Let me switch to politics for a little bit. This Sunday night, there's going to be the next debate between the 2 major Democratic Party candidates. And let me ask Yvonne and Cheryl, what does Bernie Sanders have to do? What does Joe Biden have to do? What does Joe Biden have to do to cement his position? What does Bernie Sanders have to do to change the dynamics of this race? Yvonne, you want to start?
Well, obviously health care is it's the number one thing people are talking about right now. And that's been what Bernie's talked about. But I think people understand the price tag associated with the type of care and so on. The most medically vulnerable and the most financially vulnerable people in this country still a lot of times don't have access to quality health care and so on. And it's perplexing issue, but we've still got to balance our budget and figure out how we're going to pay for that. So I don't know that he's made his case for that to the people. I think the trend is clearly towards Biden on the Democratic side, but we'll see.
What do you think about it? Does the health crisis give any boost to Bernie Sanders' call for Medicare for all?
If I take Bernie at his word about why he wants to continue with his campaign and why he wants to appear at this debate Sunday night, I believe that what we heard Bernie say was, I want to put my ideas forth. I think Bernie has come to terms with the numbers. He may create a situation or force an error. Joe does pretty well on the unforced errors himself, but he may come up with a situation where he could put Biden on the spot, but he's not going to make any voters happy by doing that. So I think what Bernie is looking to do is to get the issues of his movement, which are important to a big portion of the population, out in front. I understand the financial questions that people ask, but we didn't ask the question yesterday when $1.5 trillion was infused into the stock market. That $1.5 trillion could do a lot in a lot of ways. It could help student debt, it could help teacher salaries, but it also could help fighting this virus, which would then help the stock market. So sometimes we have to realize what's important to us, and maybe a situation like this helps to crystallize that a bit.
Caitlin, I got to ask you about state politics. The legislature was supposed to wrap up on Friday. It didn't do that. One of the big questions is the legislature going to give teachers a raise this year? And because of everything that's happened in the last 3 weeks over coronavirus, the whole question about the state budget is up in the air.
Right, and DeSantis made that a big push, right? And the thing about politics and governing is unpredictable things happen. I think when he made that push and that commitment, there was no way to tell that the state's economy and the nation's economy would be grappling with this. So lawmakers now have a very short amount of time to weigh what do you do on something that you've been working on for a long time and committed to, and how do you balance now something that's rapidly developing and could have unforeseen consequences. I don't know what that's going to look like, but hopefully we will know next week.
Okay. Well, the entire state of Florida will be voting in the presidential preference primary election next Tuesday, but also on that same day, March 17th, several local communities will also be holding municipal elections, and here they are. Well, before we go, what other news stories should we be paying attention to? And let's start with Caitlin. Caitlin, your other big story.
All right, I'm going to take us away from coronavirus and elections. Transportation lately in Tampa Bay, transportation funding has been all about Hillsborough. We know there's a lot going on there. But this week in Pinellas County, the county administrator has been meeting with county commissioners looking at what are they going to do about their transportation funding issues. And he met with them this week and can expect to see potentially now debate about Pinellas putting a sales tax referendum on its November ballot.
Just like Hillsborough's.
Yes.
And when will we find out about the Florida Supreme Court and Hillsborough's sales tax
there is
referendum?
no timeline for the Supreme Court. They have to have a certain level of consensus, and if it gets done in 2 weeks, great. If it gets done in a year or more, that's also an option. So it's really just a lot of waiting for Hillsborough.
All right, Cheryl, your other big story.
I think my story is that there are no stories other than the coronavirus and the presidential primary coming up. I've searched my brain this afternoon trying to think of those. But I think the things that it has focused on, which I alluded to just a moment ago, but another one would be why are we closing universities and colleges, and we haven't made an across-the-board decision for our younger children, the primary and secondary schools. We have a young woman running for the state senate in our area, and she is a teacher, and I have watched her this week, Amanda Linton, let me get that in there. I have watched her this week shift back to her teacher role, and she's saying we're going to have students who rely on their schools for lunches. We're going to have students that rely on the schools for their social comfort levels. We're going to have students who rely on the schools for their safety. While she advocates very much getting them home and getting them safe, there are things that we could do in the school system that that would alleviate those students.
They may go without the breakfast or the lunches that they get at their public school.
Absolutely.
Yvonne, your other big story.
I agree with both of those. I think those are extremely important. But I would say the economy, and it is, of course, related to coronavirus, but the economy of what's going to happen here in Florida. I do love the leadership that has happened just in real time. Visit Florida is funded. We need that. That has to stay. Department of Economic Opportunity is stepping forward with surveying and pushing out, figuring out what do our businesses need, how do we support our businesses, and make sure that our economy may have a bump, but that we can plug back in and be as strong as ever and give the tools and support to our businesses to be
for
successful.
Sure. Let's hope we all get through this. Thank you all for donating your time to WEDU and coming down to the studios. Great to have you here. Well, thank you for watching Florida This Week. Your comments are always welcome. Please write us at ftw@wedu.org and continue the conversation on Facebook. You can watch this and past shows online at wedu.org or on the PBS app. And you can hear this program Monday on the radio at 11 a.m. on WMNF 88.5 FM. Please join us again next Friday night at 8:30 and Sunday afternoon at 12:30. And from all of us here at WEDU, please be safe this weekend. And remember to vote this Tuesday and have a happy St. Patrick's Day.
Florida This Week is a production of WEDU, who is solely responsible for its content.